Signs of vulnerable adult abuse can include inadequately explained bruising or welts on the skin, especially those appearing on the face, fingerprints or handprints visible on the face, neck, arms, or wrists, burns from scalding or cigarettes, cuts, lacerations, or puncture wounds, sprains, fractures, or dislocations. Additional signs include unusual weight loss, malnutrition and dehydration, over-medicated or extremely sedated. Look for victim's behavior or if the amount of medication available does not match the prescription. Being closed off in a room or signs of being restrained, such as rope marks on wrists. Poor personal hygiene, including soiled clothes, dirty nails and skin, matted hair, odors, and the presence of feces or urine. Remember, it's not your role to verify that there is abuse occurring, only to alert us of your suspicions. Additional signs would be if the vulnerable adult is afraid to speak in the presence of the caregiver or looks to the caregiver to answer questions, denies, minimizes, or blames themselves for what happened, appears afraid, embarrassed, ashamed, withdrawn, or depressed, sudden changes in the vulnerable adult's financial activity, significant withdrawals, suspicious changes made to wills, power of attorney, or additions of names to the vulnerable adult's signature card. Suspect vulnerable adult abuse if a caregiver displays any of the following behaviors: makes threatening remarks or behavior, has conflicting stories, for example, how the vulnerable adult was injured, makes insults and expresses aggressive behavior, is withholding of attention, security, and affection, has an attitude of indifference or anger towards the vulnerable adult in their care, shows unusual fatigue or depression, there's an obvious absence of assistance or attendance, or there is a history of abusive family behavior or other hostile behavior patterns that can predispose a caretaker to acting out his or her anger, especially when under stress. Some caregivers are ill or disabled themselves and lack the ability to provide appropriate care, while others deliberately inflict harm upon or take advantage of vulnerable adults. If you're aware of someone who's caring for a vulnerable adult and exhibits any of these risk factors, refer them to resources in your community that would be able to help. If you don't know where to find help, you can go to or refer people to this website, nevadacareconnection.org, which is a resource that can connect you to long-term services and supports, including caregiving resources. Or you can call Aging and Disability Services Division to speak with a community advocate who can help you guide to resources in your area. It's important to remind caregivers they are not alone and there is help such as respite programs and support groups. If we can provide support to lessen the burden by providing help, education, and resources to caregivers, we might be able to prevent some abuse from occurring. Who is affected by abuse in later life? As you can see from the demographics on this slide, those most likely to be victimized are older females. A statistic from the Center on Vulnerable Adult Abuse, Center of Excellence on Elder Abuse and Neglect in 2011, a person over 80 years of age is 2 to 3 times more likely to be abused and may be a person with a cognitive impairment. 2/3 of the reports examined identify women as victims. However, it's worth noting that victimization does not discriminate by race, sex, income level, culture, or ethnic groups, sexual orientation, religion, or marital status. It has been estimated that abuse of elder women by their spouses is increasing among the growing over 60 age category, and that women do suffer a higher percentage of abuse than men. Often, the vulnerable adult resides with the alleged abuser and has developed a dependency on the abuser to meet some or all of their daily care needs. The vulnerable adult often is living with a parent, an adult child, significant other, or spouse. People with intellectual disabilities, ID, or developmental disabilities, DD, are more likely to be victims of a crime as opposed to a perpetrator of a crime. Individuals with ID or DD are often taken advantage of and exploited. Often this is done by family, friends, and caregivers. More than 90% of people with developmental disabilities will experience sexual abuse at some point in their lives. Individuals with ID or DD are often the patsy or fall guy who takes the hit for a crime in an effort to make friends and to fit in. According to an article, The Sexual Assault Epidemic No One Talks About by Shapiro Joseph, 2018, the rate of rape and sexual assault against people with intellectual disabilities is more than 7 times the rate against people without disabilities. Among women with intellectual disabilities, it's about 12 times the rate. There are multiple reasons vulnerable adults do not admit the abuse, including a fear of retaliation, fear of not being believed, fear of being sent into a nursing home, or being taken away from their homes and pets. They worry their caretaker might be removed from them, which would increase their vulnerability that they will be alone or without the care that they need. It is significant to note that the majority of abusers are family members, and it is very common for the victim to feel ashamed that their children, spouse, or caretaker is mistreating them. Older generations were more likely to have been raised to not talk about their problems, and the unwillingness or inability to discuss the abuse may lead to feelings of further isolation and shame. These types of emotions may then increase the likelihood to experience further feelings of stress, anxiety, frustration, and depression.